Hi, welcome everybody. This is the Student Health Insurance Info Session, sponsored by both GMS and SBH. Some of you may know me. I'm Kimberly Arena. I'm the Director of Graduate Affairs in GMS, and I'll let my counterpart introduce herself.
Hi, everyone. Good afternoon. My name is Robin Valsili. I am the Wellness and Communications Manager in Graduate Student Life for the School of Public Health.
Great. So from here, we'll just remind you, you can pop any questions you have in the chat, and we will hand it over to Scott Struthers, who is the representative from Aetna Health Insurance. It's all yours, Scott.
Excellent, thank you. Good afternoon. I'm just going to go through presentation deck here, but as Kimberly said, please feel free to put questions in the chat. We've left time here on the end here for questions and answers. Hopefully I will cover most everything that I think you will ask, but that doesn't mean I'm going to get everything. I've done this for about a decade now with SBH and GMS, so I think I've got many of the common questions anyways, but at least I can bring up. So one of the quick things I just want to highlight here is that you actually have a choice between two different plan of benefits that the university makes available to you. There's the basic plan and the plus plan. So while you currently can waive the insurance if you have comparable insurance of your own, if you do not waive, which you have until I think the third week of September this year, to do so, if you do not make a selection, you would automatically be defaulted onto the basic plan. So if you wish to upgrade to plus, you want to do that through the university. I believe your student link gives you the option to do that, again, up until the deadline date. If you have problems or issues with doing so, you want to contact student accounting. They generally are the ones who can handle all of the sort of administrative changes behind the scenes to make that happen for you and get that information to us. As of right now, as of August 15th, if you have not yet waived, then you are most likely showing in our system as active for coverage as of August 15th of 2022. And if you haven't made a change from between basic and plus, that means you are showing as basic at the time. One thing I do highlight for everyone's sake is you cannot change to plus after the deadline date until next year. So you can't make that change come January if you decide, well, maybe I want to be on plus now instead. You must wait until the following year. So it is important that you make that decision by the deadline date. As you can see, there's a difference between the cost of the two programs. The plans both cover all of the same types of services. They all cover the same types of medical conditions. There's just a difference between the financials of how the plan pays out. I'll go through that in a moment for you. And one other thing I will highlight here, just talking about basic and plus the differences. The basic plan covers students only. If you are trying to cover a spouse or children, you cannot cover them on the basic plan. You must be on the plus plan to do so. And again, you can do that and find more information at our website. And I will go through the website just briefly for you in a few moments as well. So this is what we call, again, the dual option. So yeah, so you have until September 20th to make that change. One thing I will make sure you are aware of is this plan does not require referrals for students on the medical campus. So you don't need to select a primary care and tell us who that is. Although I do highly recommend, if you are new to the Boston area, choose a primary care provider that will be a coordinator for your care. It's in your best interest. You have a couple options on that. We'll talk about those in a few moments. Talking about just the basics between the plans here. I will go through each of them, and then we'll talk a little bit about some of the side-by-side comparison, if you will. Again, they both cover all the same medical conditions and the same types of services. It's just a difference between how much the plan is going to pay versus how much you're going to pay out of your own pocket. So there is a policy year deductible of $250 for the basic plan. On the plus plan, that's $150. The major highlights of differences here: physician office visits. If you're going in the network, it's a $40 copay if you go for any type of a sickness visit. On the basic plan, on the plus plan, that's 25. Preventive care, both plans cover preventive care. So if you need a wellness exam, you do get to have one of those, one per year. There's no cost to you. Deductible does not apply to that. And then urgent care in emergency rooms. Again, the difference between the cost on those, what you would pay as a copay. And, you know, that's really the main thrust of the changes between the two plans and what they are. The reasons you'll see the difference in the cost between urgent care and emergency room, they are more costly. And we'll talk a little bit about options that you have there and what the cost of those visits are in a few moments. And again, this is the plus plan. So again, you can see the differences between the $150 deductible, the $25 copay there. On the urgent care, it's a $50 copay. And on the emergency room, it's a $100 copay. And this just kind of gives you a slide. So I think, you know, when I'm sure, Kimberly, if I haven't already given this to you, I'll give this over to you. You can send this out when you send the video. I think this will be helpful for folks just to kind of see the difference between those two. You can find more information on our website. I highly recommend that you do take a look through the benefits themselves. I'll, again, talk about the website in a few moments here, and we'll kind of show you just where you want to find that. Switch over to share. So as you are on our website, where you want to go to is to find view your insurance plan. And when you do that, you'll find the documents there. So the plan design and benefit summary is the document that you really want to look at. This is just what it looks like if you open up that link. And it kind of shows you basic plan versus plus plan side by side as you look through all of the different services of what the plan covers. So you really can get a good snapshot view and can make a decision on which plan you want to choose and see them both together. I highly recommend looking through this, and it does get into some pretty good details on things like anesthetists and surgical assistants, et cetera, so forth. So you can get a very good feel for what the plan covers. If it does not answer all of your questions, your options really contact our customer service area. They'd be happy to go through and walk through any of your questions you might have. Really the best resource for you to do that. And again, you can find that at edistudenthealth.com/BU. Other things that you want to take advantage of is to download the Aetna mobile app. This is just a great feature for you. ID cards. It kind of highlights to all of you folks that one major thing. We do not mail out ID cards to everybody. They are available to you to download. You can get them through the app. You can go to our website. There is a place here that you can get that. All you need to have, if you're using this here, is just your UID and your date of birth. You can pull that up. You can print that off and have a copy of that. If you really want to have one mailed to you, you can contact our customer service area and they will go through and order one for you. It does take about a week for you to get that if you really wanted to have that. But the app is really the best feature I can recommend to you. This will also allow you, when you have claims that are being submitted in from providers, you can get the details on that and see how that paid out. If you're getting an invoice from urgent care center for the $50 copay, you want to make sure that was correct. You can come in and check out the details of the claims here. Also helps if you're trying to find providers. I think this is the best way to do it. You can do that through our website as well too, but on the app, it gives you using the GPS functions of your phone. So you can see them on a map. You can find out what's the closest. I know for many of you folks, you're probably not living out in central Massachusetts. You're right up in the city. So a lot of things you're doing is walking or biking. So this is a great feature for you to go ahead and use the GPS functions on your phone for navigating yourself to the appointment as well. This is an open choice PPO network. So briefly, what does that mean? You don't have referrals that are necessary for you guys. That's only if you're on the medical campus. So don't, I mean, on the Charles River campus, so don't worry about that. But it means that you're basically in charge of your care. We have providers that are in the network, but you can feel free to see any provider you want, whether they belong to the network or not. Our network is very extensive. Boston is a very huge hub for healthcare. So every hospital that's in the city belongs to the network. There are a couple of urgent cares scattered throughout the city. They belong to the network. You have no shortage of finding pharmacies. They're all on the network. So you really shouldn't have too many scenarios where you would not find a network provider. But again, you have that choice if you wish to use an out-of-network provider. The network is also nationwide as well too. So if you are traveling, say in California for the holidays and you need to just get a provider out there, you have access to the network providers out there as well too. In terms of options, so again, this is just something that I want to kind of highlight to everybody. You're basically the stewards of the cost of what this plan is. Everything in terms of what the premium is that we charge each year is based upon what the plan experiences. How much is the healthcare benefits is the plan paid out? So this is really where I ask everyone just to kind of be the best steward you can. Certainly, I want everyone to get seen by the provider that they need to get seen by. So if it's at 1 o'clock in the morning on a Saturday, I don't want folks to have to feel like they have to wait until Monday morning to get seen. Urgent care or emergency room might be the best option. Of what makes sense for you, feel free, go. I don't want you to wait. But you do have options here that are available to you. One is Teladoc. That is a telehealth service that we've contracted with. So they are a network provider for us. They're available 365, 24/7 for most common illnesses you might have. Again, 6 o'clock on a Saturday and you're had a sore throat all day, this might be an option for you. Get to televisit and get diagnosed, and they can often write prescriptions for most things that you might need as well too. So this might be the most convenient option for you. Walk-in clinics, such as Minute Clinic, those are available as well to you. You won't find them in the heart of the city at this point. It's unfortunate. We'd like to have one. I'm an advocacy here with CVS Health all the time that having one somewhere in the city would be fantastic. But you can find them all around the outliers. So you can find them like in Cambridge, you can find them out in Brighton, etc. So those are options for you as well. And then urgent cares, again, there's some of those scattered around throughout the city. Those are a good option as well too. The other thought for you, all of you, is student health services. They are over on the Charles River campus. While you are not required to use them, they are available to you. They are available Monday through Friday. They have a little bit more of limited hours, which is why urgent care might be more of an option, or even the walk-in clinics, just because of time of your schedule. But the advantage to go into student health services, you don't pay anything. Your fees you pay the university as part of your tuition already covers you to go there. So if you have a visit there, there's no copay for you. There's no deductibles. Labs, you won't have to pay for any of those either. Those are all get covered by your fees. So that's one of the big advantages to using student health services, is that there's just nothing else you're going to have to pay out of pocket. Obviously, if they tell you that you need to go out and see a cardiologist, or it's a recommendation for you to go and get an MRI, etc., then the insurance will pick up after all those things that they send you out for. But again, your visits there's no cost. I just talked about Teladoc, a little bit more about who they are. They also can see you for behavioral health services as well too. So if you needed to schedule a visit with a counselor, you can go onto their app. You can find times of counselors and dates that they're available for appointments. That just might be a little bit easier for you versus trying to pick up the phone or go to the web and find providers on your own. So they just might be an option for you. They also can see for certain dermatology services. They have dermatologists that are part of their organization. The dermatology services, generally, you will complete out a health questionnaire through their app. They could ask you sometimes for photos. So if you're calling saying, hey, I've got this rash on my ankle, it just hasn't gone away in 4 days, I'm not sure what it is. You can take a photo of that with your phone. You can upload that through that. And the dermatologist generally will review all of this stuff. And then they will contact you and set up a time for you for a consult. So it's a little different that it's not on demand with dermatology services, but that can be very convenient for you to let them come to you and tell you when they're available. Dermatology, I will tell you, it's not just here in Boston, but across the country, is a very highly in-demand specialty. It often requires a very lengthy wait time to get an appointment. So for anyone who's had an appointment with a dermatologist in the past, I think you can attest, it's not usually that you get an appointment the next day or the day after. It's just usually take a little bit of wait. We also include travel assistance services. This is just important. You won't find this on most other private insurance or through like government programs. This is generally pretty unique to student health. That we include benefits for all of this for all of our members. So what does that mean? Anytime you're going more than 100 miles from campus, or you're crossing over into any country outside the US, you have services that are available to you for both for medical related. So if for say, tragically you ended up with into an accident in France, you need to be hospitalized, and you needed help with figuring out how is all this going to work with my insurance. The travel assistance program can help you answer those questions for you. If there was some reason that you needed to be evacuated and moved back to the US, they will help do the coordination to make that happen, whether that's going to be on a commercial flight. That instances of them having to charter airlines to get individuals back. So they will help take care of all of that. It also helps if you lose any of your documents. They can help steer you with the right way to go about replacing that, put you in contact with consulate services, even attorneys. God forbid any of you have a legal issue while you're abroad, but they can help put you in touch with attorneys that can help you with answering questions on how to navigate all of that as well too. Some other things that are included. So vision discount program. So the plan covers one routine eye exam per year. So you can get a vision exam. If you needed glasses or contacts, the insurance program does not cover that. But we have a discount program that's available to you. That is just simply with your ID card. You present that to the vision providers. They give you the discount on that at the time of sale. So if there's a 10% discount on, say, bifocal lenses, then they'll apply that right there for you. Dental is another question that I get quite often. Insurance in the US generally does not include dental benefits. It's usually as something that's separate. So the university has made available a program through Aetna. It's called our Vital Savings Program. It's a discount only program. So there's no claim submissions you'll send to us. You'll pay for these services out of your pocket. But after paying the $25 fee to us for the year, you get access to the discounts that we negotiated with these providers. So you will get anywhere from 15 to 50% off of any of your general dentistry. Also, if you wanted to have teeth whitening, there's a discount on that. But again, these are things that you'll pay for out of pocket. You'll get the discount from the provider based on what a contract with us. So it's $25 per year. There's another program that's made available through Goldman. You can visit their website. It's linked off of bu.edu, and you can find information on that. So that gives you access to using their clinic on a discounted scale as well too. So that's another option if you need a dental care. Very important information to have, again, is our phone number. Questions you may have. If you're coming off of a different insurance program and you're questioning Hey, I'm on XYZ medication. I just want to make sure that that's covered by the plan and what my copay is going to be. Call us. Happy to walk through that with you. If it's, prescription, that medication that for some reason that we do not cover, that does not necessarily mean you cannot stay on that medication. You want to call our pharmacy management folks and you want to ask them what your options are. Oftentimes, we're not looking to try and take people off of medications they've been on for a long time, so exceptions can be made. You just need to do that before you start trying to fill the prescription drug. For assistance with waivers and enrollment, again, student accounting is really the place you want to go with that. If you were to contact our customer service about a waiver, this is what we're going to tell you is to contact student accounting. It's their phone number. You go on to a student link, you can do many things there as well too. So keep that as highly important information. Just contact student accounting. Very good. Thank you, Mary. So that's really the insurance plan in a nutshell. I know that's a lot of information, but it may not be all the information. So feel free, take the time here, ask questions. I will do everything I can to answer everything I can for you. If there is something that is of a highly confidential nature that you have, that's perfectly fine. You can contact Andrea. You can contact through. No, I think Kimberly or Mary. I think you guys know how to get a hold of me. So obviously, anything I can do that helps you to contact you about anything that's of a truly personal nature or something, feel free. I will be available. I will be out of office for tomorrow and Monday, but otherwise I will get back in touch with you and answer whatever I can. And Mary, you've been at this a long time as well too. Is there anything you want to chime in with, Mary? You feel free.
Thank you so much. That was really helpful. And as mentioned before, oh, we already got a question in the chat. Perfect. Yep, put any questions in there that you have for Scott.
Yes, so PhD students from GMS, I believe, Mary, they are all still defaulted to the Plus plan, if I'm not mistaken. I think that's the way it's been for the past several years. That is part of your offer and acceptance. They make that available to you.
Kimberly, for GMS, I think it is. I know in SPH it is as well. Yeah.
I believe it is, but
I think the university funds at the Plus plan.
And it's like Scott said, it's automatically given to students, and PhDs, it's built into your stipend.
Other insurance reimbursements for the Fuller Gym. There are benefits available to you. Obviously, if you're using FitRec, that's part of your fees. I think covers that for all students at the university. But there are discounts for other gyms as well too. You can find that information. Actually, going through our app is probably the best way to go and do that. But you can find information on our website as well too.
But it doesn't cover the Fuller Gym.
Yeah, so Fuller is not part of our
program. It's not really. And right now, there's no fee to use the Fuller Gym. There may be a fee for classes in the future, but that still hasn't been determined at this time. So there are no fees for the Fuller Gym, so there's no reason to seek out insurance reimbursement.
Excellent. Mail-in pharmacy, yes, the program does include mail order. There is no requirement on which mail order pharmacy you must use. Obviously, CVS Health does have its own mail-in pharmacy, but you certainly can use others as well too. You can find information on that through our app. We'll actually walk you through the steps of how to fill a mail order pharmacy claim. So that's my best recommendation to you, or you can contact that number I just showed you, and I'll bring it up again for you in a moment if you like, for our pharmacy group. They can help walk you through that over the phone as well too. But mail order is an option for you. If you're taking a medication monthly, obviously having a mail order and getting a 90-day supply at a time is usually the most convenient, so highly recommend that. But otherwise, yeah, there's no requirement to just certain one. How do you check which plan you are on? You can certainly contact us. I think Student Link does show you which program they have you enroll through as well too. So that's an easy check, but otherwise if you have questions, contact us. That would be the next best place for you, next best way to do that. Let's see. You know, initially, yes. So if you were to turn 26 or lose your other insurance pretty much for any other reason during the course of the year, yes, you are able to come on the insurance at that time at a prorated amount. The best recommendation I would give to you, if that is the situation you will find yourself in, is contact student accounting. They will go ahead and put all of the correct charge onto your account, and they will get the notification to us. I can tell you the folks at student accounting are pretty wonderful in a lot of ways, and they are your best advocates. I can assure you of that one. And generally, we'll try to make sure everything is done and taken care of for you within 48 hours because they want to make sure that you have your coverage. Is there a fall only option? So everybody that is coming on the program right now is generally assumed to be annual. The way the university breaks up how they charge you is a little different, but you're assumed to be on for the full annual. So there isn't anything you should have to do so long as your minimum credit requirements and you're in good standing with the university, et cetera, everything will extend for you for spring. So you shouldn't have to do anything else.
Hi, sorry, just to follow up on that.
Mhm.
Right now, I'm in kind of a flux mode with work, so I'm trying to decide which coverage is better. So I believe there is a fall only option, but if it turned out that I also needed spring later on, is there an ability to add that after the fall semester?
Yeah, so you want to contact student accounting if there's a change in your status and ask them then at that time, because they'll get all that information basically from the registrar from your program.
But you have to be registered to be able to be eligible for the spring semester.
Right.
Well, you will have to have been not have graduated, I would say. So if you're doing the
Exactly.
fall only option, and you're graduating as of January 25th, you will not be eligible for spring health insurance because you're graduating.
Yeah, but if you drop down, say below minimum credit requirements.
Right.
Generally, the
Then you can do
university has been fairly flexible in the past of letting you stay on for spring, for at least that current academic year. Obviously, it doesn't extend beyond the current academic year, but oftentimes they've been flexible with that. They'll take the request and it goes through an administrative review if they need to, et cetera. But student accounting is what initiates all of that. Do I have to drop my current insurance before enrolling? Yeah, so if you have not waived, and as of right now, yes, everybody is considered as effective as of August 15th if you have not taken any action at all right now. If you have other insurance and you wish to switch, you can enroll through us and then you can take care of the drop at the other side of that. However you want to do that, it's up to you. But yes, you can generally have that option. I would definitely contact the other insurance and just confirm there's no special rules on when you can terminate and all of that kind of stuff. They don't want to see you necessarily pay for two insurances at the same time. If you had both insurances, then they coordinate coverage between the two. So whatever your primary insurance is, say if you had a $40 copay on your other insurance for an office visit, then the bill can come to us, and generally that $40 is what we'll reimburse you for, et cetera. But there may be certain rules on the other insurance. So I always recommend contacting them first. I just don't want to see you sort of get stuck in that situation where they say, no, you can't terminate this until the end of the year. So now you have two insurances you're paying for the next 3.5 months. Let it run out on the other insurance, and then you can drop it, come on to our insurance when that coverage ends if you have to. We can do nothing but talking today.
It looks like we accidentally skipped over one.
Sure.
how
How soon?
Soon will they get their ID card?
Right. So again, we don't mail out ID cards to everyone, and they're available now. So if you were in good standing with the university as far as your financials and your check-in and everything else, then we probably already have your information. So you can go to our website. You'll find the link there that shows you how to, I can walk you through that really quickly again.
Hi, just following up on that because I did check the website and I put in the information and it told me like an error. I don't know if maybe that's like different for PhD students because like their fees haven't been settled yet or something.
It could be. So that may be something that we're waiting from student accounting to share us an updated file. Student accounting sends us uh, eligibility information about twice a week, sometimes 3 times a week during this period of the year, because it is a lot of things changing and going back and forth. So if it's not there now, I would just confirm with Student Link that it's showing you having that on your account, even though if you're a PhD student and it's coming through the university's funding and not your own, it should still show up on Student Link. If
Okay.
it's showing there, then there may be an issue. I would recommend reaching out to student accounting and just have them follow up through that.
Okay, so reach out to student accounting, you said.
Yes, correct. Yeah, and if there's a scenario where there's something there, during the week, they usually can contact us and do what we call an emergency ad. They've done it numerous times as well, just to make sure that, if you needed a prescription tomorrow, that you can get it. You have something you want to also an error document. Correct. You don't need a referral. Only thing you want to do if you're currently seeing a provider in the Boston area that's, with a different insurance plan and now you're going to be using them on this one, just notify them of the change of insurance. If you have a state insurance plan like Medi-Cal from California, correct. So generally speaking, most out-of-state Medicaid programs are not acceptable for waivers because they do not cover you in the Boston area, except in an extreme emergency. In some states, it literally has to be a life and death scenario before they'll pay for any benefits for you if you're out of state. So that's why the university, following in accordance to what the state mandates, has to deny most out-of-state Medicaid programs. Now, if you're on a Medicaid program from another state, that doesn't necessarily mean you might actually be eligible for Mass Health. That's a question I can't answer and the university can't answer for you. So you might want to reach out to Mass Health, which is obviously our Medicaid program here, and check with eligibility on that. If you're on Mass Health, you can waive the insurance. We're not going to force you to have both because obviously that is comprehensive and works here for you. For a PhD program, so that's a scenario. So which program depends on what you're at, I think maybe is the answer to that one. Again, GMS, it's automatically defaulted that you're at the plus plan. So there's nothing else for you to change there. For SPH, I don't know. If that's,
I thought it was the same, but
I think
for SPH. Yeah, so
Yeah.
you should already automatically receive that, but obviously check in your student account what the price is for the insurance that you've received, and that will confirm which plan you're on. And if you need more assistance with that, I would say reach out to your department, who kind of handles the cost structure of those charges.
and I think if you go back to your acceptance offer letter, I think it tells you right in there that you're on the plus, if I remember. It's been a couple of years since I've
Exactly,
seen one of those,
exactly.
but yeah, I'm pretty sure it does tell you.
Yeah.
So yeah, if you had both, yes, absolutely. So, basically what's going to happen is you're going to have a coordination between Aetna and Medi-Cal. Will generally be primary. That's the way Medicaid Medicare programs work. Is if you have private insurance, they're always primary for you. So you would use that our insurance first, and then whatever the balances are on top of that, the provider sends to Medicaid. So again, if you were on the basic plan and you had a $40 copay for seeing a neurologist or an orthopedic or something like that, then the $40 will go to Medicaid for reimbursement as well too. So at the end of the day, most scenarios you won't have any out of pocket yourself. Anything else you can
Okay.
think of?
I was gonna say, it looks like we're caught up on questions unless there's anything that's lingering. Otherwise, thank you so much, Scott.
Absolutely.
And for the GMS students, if you have questions after this, you know how to contact Student Affairs. We can connect you with any person that you need to talk to, whether it's finance people with your about stipends if you're a PhD student, or where to go look on the Aetna page. So just let us know if there's anything that didn't get answered. And as a reminder, this session was recorded, so we'll have it available hopefully next week for all of you to reference in case you need to go back and look at some of the specifics.
Excellent. I don't have anything else to add, but for the School of Public Health students, feel free to reach out to Go to Student Life. We're happy to guide you any further with all this. But Scott's been great. He's been working with us for a number of years now, and really has been able to kind of put this presentation in to be a great support for students right at the very start, where you have all those burning questions about what to do and how to do it. But we posted some links in there. Be sure to check those out if you need to waive it or you need some more information about the student health insurance plan. But we wish you a very happy and healthy year and hope you won't need to use your insurance too much. Actually, just one little caveat I will say is that I've heard from a number of students who are beyond pleased with the mental health resources that this plan covers. So if you're a student who utilizes those services, those are really, the student health insurance plan really has done a great job of really trying to dedicate resources to support students in that area.
Great. All right, well, thank you, everybody, and thank you, Scott.
Thank you so much, Scott. I hope you have a wonderful few days off.
Yes, thank you very much.
And we will see everybody in the beginning of September
Next
for
week.
orientation.
In a couple of weeks. Yes.
Best of luck,
Bye
everybody.
now.
Thank you.
Bye now.